My name is Bianca Broughton, and I'm the head athletic trainer for Dallas ISD. When an athlete has an ACL injury, you have to think about them as the whole. So it affects them mentally, it of course affects them physically, and you kind of have to get them through all of the different stages of not necessarily grief like you're losing a loved one, but grief of losing their sport for that short amount of time that they're not able to go out and participate and be around that team environment. So there are a lot of different things you can do. I know with our athletes here, when they're hurt, whether it be ACL or shoulder, we try to still keep them as part of that team. So if that means we have to move a rehab outside during team practice time so they feel like they're around their peers and their friends, then that's what we do for that mental health aspect of it. So what we do for the girls versus the guys would be totally different as far as training and preparing their bodies for competition. Of course, girls are at higher risk than guys. Females on average have wider hips, and then their knees kind of collapse a little bit just because of how wide the hips come out. So a lot of the preventative programs we do are based on muscle flexibility and the strength, and as well as the balance. With the physical aspect, we set goals. So if you tore your ACL and you just had surgery, the doctor has a set list of goals that he wants us to achieve as far as range of motion and strength. But we also set goals with our kids so they know what to expect, whether that be a week from now, a month from now, a couple months down the road from then. Prevention and practice, we kind of focus on their deficiencies. So if it's a muscular imbalance, we test, we find out what those are, and we fix it. If they're compensating in some type of way, if their gait is off, we fix the little things we know are not in line with what we know their body needs to be to optimally perform, and we kind of attack those head on and fix those. So the stretching, the preventative with the strengthening, the icing and making sure their body has time to rest and recover. My experience definitely helps because I know what the kid is going through. I know their fears of, I was a top caliber athlete and, great in my sport, and now I'm missing that part of the action because I'm unable to perform physically. So I'm able to connect with the kids on that level, and I feel like it helps me kind of guide them over those road bumps we might hit with the confidence or any setbacks and rehabs. I'm able to provide them more of a support in moving forward because I've been through the process. So I think that helps tremendously when trying to relate to an athlete with an ACL injury. So you have to look at the kid as a whole, to look at how that injury could affect their day-to-day at home.